my name is Amber. I'm going to be your nurse today. I'm going to be assessing your abdomen, your musculoskeletal, and a little bit of your neuro. First, I'm going to look at your abdomen. Your abdomen looks symmetrical. Take a deep breath. Perfect. I was just looking at your respiratory and your abdominal muscles. You don't appear to have any lesions or scars, masses, nodules or anything. Your skin's even texture. I'm going to listen to your bowel sounds. Perfect. I hear all of them in all four quadrants. I'm going to listen to your vascular sounds of the arteries. Listen to your aorta. Listen to your renal. The iliac. Listen to your femoral. I don't see any visible parasolis or any palpations going on in the abdomen. I'm going to percuss your stomach right now. Perfect. Let's see. I'm going to feel your abdomen. I'm going to do a light and then a deep palpation. Tell me if you feel any tenderness. Any tenderness at all? No. I'm going to go a little bit deeper. Any tenderness? No. I'm going to feel for your liver. Any tenderness at all? No. I'm going to feel for your spleen. No. I'm going to feel any kidneys. Any tenderness? No. Alright, now I'm going to feel for your pulses. I'm going to feel for your aorta. I'm going to feel for your femoral. I'm going to feel if you have any lymph nodes present in your inguinal area. Okay, I'm going to do something called the Murphy sign. So what I'm going to get you to do is take a deep breath and tell me if you feel any tenderness whenever I push. Take a deep breath. Let it out. Any tenderness? Okay, I'm going to do something called the Rovinsky's sign. So tell me if you feel any tenderness. No. I'm going to do something called the Lipoxa test. So what I'm going to get you to do is lift up your right leg and push down. Feel any tenderness in your abdomen? Okay, perfect. So now I'm going to inspect your legs. I'm just going to look to see if they're even in the length, the hair distribution is even, your skin color is even, no lesions. I'm going to test your range of motion and your strength right now. So if you could lift both, or a leg up and then back down. Okay. Now if you can bend your knee and back down. If you could take your leg and twirl it out and back. You do the same thing. And then if you could take the leg and swing it out and back in. And same thing for the other side. Okay. Now if you could bend your knee. And then push. Okay. Point your toes. Flex. Push against my hand. Perfect. Now I'm going to feel for your arteries in your legs. I'm going to feel for the femoral. Lift up your leg. I'm gonna feel for the popliteal. I'm gonna feel for the posterior tibial. And then the dorsalis pedis. I'm going to do a neurologic test, so what I want you to do is take your heel and scrape it or rub it against both shins. Okay, so if you could sit on the edge of the bed for me with your back facing. I'm going to percuss your kidneys. Perfect. So if you could sit down in this chair. I'm going to assess your upper extremities. So what I want you to do is pick your arms like this, then back down. You push them back like that. Perfect. And then could you take your hands and do it like that? Good job. Go your arms like this, and then back down, behind your head. Good. Okay. Elbows. Back down. You could put your hands, flex, back up, like this, like that. If you could spread your fingers out and put back together, closed fist, open hands. Okay, so now I'm going to check your strength. So if you could push against my hand. Good job. Push against my hand. Perfect. And then stand up. I'm going to check to see if you have scoliosis. Okay. Good job. Thank you. Okay, so I inspected the abdomen and the contour was within normal limits. I didn't see any visual peristalsis or any palpations. Her abdomen was symmetrical. Her umbilicus was midline. Her skin was even. There was no masses or nodules or lesions or scars. Whenever I auscultated the bowel sounds, I heard them in all 4 quadrants. Whenever I listened for the vascular sounds, the aorta was audible. The renal, iliac, and femoral bilaterally were all audible. Whenever I did a general percussion, it was all within normal limits. Whenever I did the renal percussion, it was in normal limits. And listen, feel light and deep palpations. No tenderness noted. No, I couldn't feel any masses or nodules. Whenever I felt for the liver, the spleen, and the kidney, they were not palpable. Neither was the inguinal lymph nodes. The aorta and femoral artery were both palpable. The Murphy, Rovinsky's, and the Lilopopsis tests were all negative, and so was the scoliosis test. It was negative also. The lower extremities were equal and symmetrical. The skin was even with no lesions. The hair distribution was even on both sides. Range of motion and strength bilaterally were equal and strong. The femoral, the popliteal, the posterior tibial, and the dorsalis pedis arteries were all palpable. The heel to shin neurocheck was negative or positive. The upper extremities were even and symmetrical bilaterally. Range of motion and strength were equal and strong bilaterally.